I hope it's everyone's goal here for the rest of your, starting right now, to obtain and maintain health and wellness naturally so you enjoy a better quality life as you mature. Many people that you know, some of your closest friends, are sick and tired, and they're sick and tired all the time, and that produces a whole host of negative effects in their lives. Attitudes aren't really good when you're sick and tired. In fact, they tend to be negative. Relationships aren't as strong as they should be. Sometimes they deteriorate. Activity in the workplace isn't good. Don't enjoy recreation or fellowshipping with your friends at church or in your neighborhood. And life tends to become very difficult for people who are sick. So what we want to do today is first share with you some bad news about what you're facing if you don't get on a path of health and wellness. And then we're going to share with you some solutions that can help you prevent these problems from occurring in your life. As you all know, we're not going to live forever. We know that. But my philosophy is while we're alive, we ought to be healthy and well. We ought to feel well. So let's talk about the 6 dangerous health trends affecting men and women in midlife. And I guess that's us. I'm looking through this audience. Many of us look like we're approaching midlife. They say that midlife is always 5 years older than you are, you know. So it's about 64, 65 for me. That's going to be midlife, so we're not quite there yet. Okay, the number 1 cause of death in America is heart disease. We've heard about heart disease. Everyone in this room has known somebody who had a sudden death. A family, a friend, somebody at church, somebody at work. You went, oh my gosh, they were here yesterday and they're gone today. They're gone. They died. What in the world happened? Well, each year over a million Americans will suffer a heart attack. 750,000 people will die this year alone of heart disease. Slightly more men than women, but women is still the number 1 cause of death in women. 47%, almost 50% of cardiac deaths occur before there's any emergency treatment. It's silent. You were here one moment and you're gone. It hits you and you're gone. And you know, what kills you with a heart attack is the arrhythmia, the irregular rhythm that's caused when the blood flow stops to certain areas of the heart and the tissue begins to die. It sets off some abnormal electrical currents which cause arrhythmias, irregular beats that the heart doesn't pump properly, and so you don't get good blood flow, and that's what causes the death is the irregular heartbeat. It's almost $500 billion every year in direct and indirect expenses on heart disease. There's usually no advance warning. Over 6 million people each year will annually be placed in the hospital due to cardiovascular disease. Every day, over 2,000 people will die from heart disease. Every hour today, 85 people in this hour will die of heart disease in America, 1.5 person every minute. And there are over 7 million inpatient cardiovascular operation procedures every year. It's big business. It costs a lot of money, and it's something that can be and should be corrected. Now, unfortunately, because of the lighting in this room, you can't read this very well. So let's go down the causes of heart disease. By the way, the presentation that I make today, we're going to pass out cards at the end of this or sometime during the program, let you fill out a card with your email. I will email you the entire presentation so you'll have it as a PowerPoint for yourself if you'd like that. I think it'll be helpful. Causes of heart disease. How many people think heart disease is caused by elevated cholesterol? Well, y'all been listening, most of y'all, many people do, okay. A lot of people listen to the program. Cholesterol isn't the cause, it is the messenger. It's the healing process by which the coronary arteries try to heal themselves from the inflammation that causes the heart disease. So, viral and bacterial infections, when they escape from certain areas in their body and circulate in the blood, they can get in the coronary arteries And the toxins from the bacteria or the bacteria viruses themselves will bore little holes into the coronary arteries. And the body's got to heal itself. It's got to patch that. It does that by two mechanisms. It either lays down collagen and heals the interior of the arteries, or else it'll lay a Band-Aid down if it can't produce enough collagen. And the Band-Aid is lipoprotein A, which is derived from cholesterol. So that's the way to patch the artery. But that's what the body's supposed to do. It doesn't want a raw sore in the coronary artery. It wants to heal it. And the body, if it doesn't make enough collagen, will use the cholesterol as a backup mechanism to heal it. So the cholesterol doesn't cause you to develop the inflammation. It's simply the healing process by which you try to correct the inflammation. Second, as a backup mechanism to collagen. Poor healing of the coronary arteries is a cause of coronary artery disease when we don't have enough vitamin C to make collagen. You got to have vitamin C to make collagen. Trans fatty acids, margarines, vegetable oils, or abnormal oils. They're heat treated by the food companies so they don't go rancid. Some of us here are old enough to remember old oils. You ever seen oil that goes rancid? Well, you probably haven't. If you use vegetable oil, it never goes rancid. The roaches won't even eat it. It's trans fatty acid. They change the chemical structure of the oils. And our body needs oil. Every membrane in our cell, every cell has a membrane around it that requires good essential oils. And when we put trans fatty acids, like in margarine or shortening or fried foods or the chips and dips or the salad oils that we use, that clogs up the membranes and that cells don't function as well, and that leads to hardening of the arteries. Chemical pollutants do the same thing. When we drink, I hope we're drinking out of glass. Are we, Jenny? We drinking out of glass bottles? Good, and there's a reason for that. When you drink out of plastic bottles, you say, well, I'm going to drink distilled water out of a plastic bottle so I can be healthy, but that plastic bottle has phthalates in it and biphenyls in it. And those substances are petrochemical products that get into our system, and they deteriorate our arteries and they deteriorate the cell membranes. They're dangerous, and they localize in the fat in our body. Those are chemical pollutants that we literally put into our bodies in the food that we eat, and the soft drinks that we drink or water we drink out of plastic containers. Heavy metal, mercury, can lead to deterioration of cell membranes and cause cells to function abnormally, which can lead to hardening of the arteries. What kind of heavy metals might we get in our body? What about the mercury that we all have in our teeth? You know, the dentist has to take that if you get that removed from your teeth, you know, the dentist has to wear a special mask and has to have a special vacuum that sucks the noxious fumes from the mercury out. They have to be stored, and they have to put the mercury in special containers, and that mercury has to go to storage sites for chemical wastes. And we put it in our mouth. Vitamin and mineral deficiencies. We mentioned vitamin C. Low levels of lysine and proline, which are essential to make collagen, are important. Shown that vitamin D levels, when they're low, dramatically increase the risk of heart disease. When you get vitamin D levels at high levels, you dramatically decrease the risk of heart disease and cancer. Pharmaceutical drugs can lead to heart disease. The beta blockers, the statin drugs, can lead to congestive heart failure. Low thyroid and hormonal decline all can be causes of heart disease.